Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsor, Aultman Health System. Today, pharmacist Brad White and I broadcast from our administrative offices, and our special guest is Dr. Mihail Paxos and Aultman Deuble Heart and Vascular Hospital cardiovascular Colton. Sorry. Good morning and
Oh,
welcome to you. Welcome to the show.
hi, how are you?
Very good.
All right, Aultman Deuble Heart and Vascular Cardiovascular Consultants is the largest and most comprehensive group in our 7-county region. As a full-service cardiology group, they specialize in clinical cardiology, interventional cardiology, and electrophysiology. So we'd like to remind our listeners that our program is also available on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe to our program.
So, good morning again, Dr. Paxos. Tell us a little bit about yourself and your career with Aultman Hospital.
Sure. I'm Mike Paxos. I grew up here in Canton, Ohio. I was actually born in the old part of Aultman Hospital. So I ended up back here sooner than I thought. I went to Hoover High School, graduated in 2001, and went to medical school at Northeastern Ohio Medical University, NeoMed, up by Kent, and did my residency at Case Western at University Hospital. And I did my cardiology fellowship at NYU Long Island, at the border of Queens in New York. So,
New York, huh? Jeez.
Yeah.
How was that in New York? Gosh.
New York was fun. It's very crowded. I don't think it would be feasible to raise a family the way that you can raise a family here in Ohio. Just too busy, too much clutter in New York, I think. But
Wow. So what is your specialty in cardiology?
so I specialize in interventional cardiology and structural heart disease. Interventional cardiology, we place stents during heart attacks to stop heart attacks and to take away angina when patients have blockages. And then structural heart disease is valvular pathologies or anatomic defects of the heart. So I replace valves through catheters. So I can replace aortic valves and mitral valves through catheters instead of open heart surgery. I can repair mitral valves through the leg instead of open heart surgery. And we can fix defects such as holes in the heart, like patent foramen ovalis. So I close those as well through the leg as opposed to having to do open heart surgery.
God, that's amazing. Jeez. So what other common conditions do you treat, doctor?
So in my practice, I treat everything from atrial fibrillation to high blood pressure to high cholesterol, obviously heart attacks, treatment of strokes, and treatment of valvular pathologies, like I had just mentioned, but treating basically anything within the realm of cardiology.
Boy, changes in heart is really something in the last few years is amazing.
Yeah, some of these things we didn't even learn about in medical school. That's how new some of these technologies are.
Yeah. I've been around a long time, and I remember when they started all these heart transplants, and that fella in Africa, I can't remember his name, that did the first one.
Yep.
And the guy from Texas, the doctor down there, was involved in that too.
Yep.
But we're not doing heart transplants very much anymore.
Oh, no, heart transplants are very common still. Just those are done more commonly at what we in medicine call tertiary or quaternary medical centers. So those are larger hospital systems. So larger hospital systems, University Hospital, Cleveland Clinic, are involved in transplant. More recently, there are technologies like heart pumps called left ventricular assist devices, or LVADs. So those are what we call destination therapy. It could be we place this heart pump, and that's kind of your destination. You're going to live with this heart pump, and it's going to help prolong your time on the planet, improve your quality of life. Or sometimes we use that as a bridge. So we put in an LVAD and bridge you to a heart transplant while you're waiting for a compatible donor.
Wow.
Wow. So, doctor, let's talk about coronary artery disease. It's something we all deal with quite a bit in healthcare, whether you're the surgeon or the doctor or the pharmacist. So let's talk about how we can help our patients learn more about coronary artery disease today.
Yeah, sure. So, unfortunately, coronary artery disease is a side effect of being on the planet. So the longer you're on the planet, the more likely you are to have significant blockages. The rate at which you form these blockages is different from person to person, and that's dependent on a multitude of things. One of them is genetics. So that's what we term an unmodifiable risk factor. I can't change your genetics to change your risk of heart disease. And some of these things are modifiable risk factors. And we try to focus on modifiable risk factors. And how do we modify those things? Well, I think the most important thing is firstly, a heart healthy diet, exercise, not smoking. So those are three of the most important things you can do. And I would say even more important than medications. And then, of course, when we have severe pathologies, we have to start thinking about pharmacologic treatments, cholesterol pills, blood thinners, blood pressure pills, and pills to help control blood sugars. I like to try to focus on preventative heart disease, because once you end up in the cath lab and I'm putting a stent in, we've kind of entered a different realm. Once you have a stent, you're at a higher risk of ending up getting more stents, because that's a disease process that once it starts, it's kind of hard to stop. It's kind of like a small smoldering fire in the background. And once that starts, we have to get very aggressive with pharmacologic treatments to try and slow down that disease process.
I had a heart cath some time ago at Aultman, and I was absolutely amazed with the staff and how efficient they were and how pleasant they are. Something that I thought was, oh my God, this is going to be terrible. Really wasn't. It was smoothly done, and the staff in that lab were just fabulous. So
I mean, we take pride in our staff here. I think that's one of the most special aspects of Aultman Hospital, is how much our staff care and how much passion they have in providing cardiac care to patients.
good.
So let's talk about who is at high risk for cardiovascular or coronary artery disease.
So high risk patients are people who have diabetes. So diabetes is actually considered a coronary equivalent. So if a patient comes in and says, oh, I have diabetes, that's somewhat considered you've already had a heart attack or you've already had a cardiac event. So diabetes is probably one of the largest risk factors. Advancing time on the planet, like I mentioned before, the longer we're here, the more things wear out, and our blood vessels wear out just like a knee wears out or a shoulder. So advancing age, diabetes, high blood pressure is a risk factor. Smoking, and obviously hyperlipidemia, or what we call high cholesterol, is a risk factor. There are ways for us to help calculate what a patient's risk is over a 10-year time frame. We have a database with millions of patients in the database, not Aultman, but cardiology in general. We type in a patient's age, weight, sex, blood pressure, most recent laboratory values, including their cholesterol values. And at the end of that calculation, it'll give you a percentage risk over the next 10 years. So if you're typing those criteria in for a patient and the patient's risk is higher than 7.5% over the next 10 years, that means you have a 7.5% chance of having a major cardiac event, in the next 10 years, we consider that very high risk. And that's when we get very aggressive with modifiable risk factors, getting blood pressure down into a normal range, getting your bad cholesterol down below 70 or now even 55 or 60, and controlling your blood sugars.
You know, you made me think of something, and it's probably beyond the scope of our program today, but with what you just said about helping someone identify their risk factors, how many times do you get to see a patient before they have a high risk situation? Are we doing better in healthcare yet of getting to that patient that needs to increase their exercise or needs to decrease their fatty diet or something before they unfortunately end up in your office? Not that I
Yeah,
don't want
well,
you to be busy, but
yeah.
you know what I mean.
So,
So,
so actually, quite often I see patients who are very concerned with primary prevention. So somebody self-refers in their 40s and says, "Hey, my mom and dad had heart problems in their 50s. I don't have any symptoms, but I want to know, is there something I should be doing different to help prevent that genetic kind of path into heart disease into your 50s?" So that's actually a large proportion of our practices, is what we term preventative or primary prevention in cardiology. And that's just as important as treating somebody who actually has already developed heart disease. And quite frequently when patients come in for that primary prevention, we actually pick up heart disease sometimes, and that's an impetus for us to really get aggressive with cholesterol management and blood pressure control.
good.
Okay, doctor, time for our first break. You are listening to Health Matters with the Medicine Center Pharmacy. Okay, guess we're back. Welcome back to Health Matters with the Medicine Center Pharmacy. Are you ready for vaccine season? Stop in and schedule pneumonia, Tdap, or shingles vaccine online at midshoprx.com.
All right, doctor, we were talking about risks
Mhm.
of coronary artery disease before the break. Does
Yeah.
gender or genetics play a role in cardiovascular disease?
Yeah, so gender plays a role in heart disease, and so does genetics. So there are genetic conditions where you have pathological elevation in cholesterol. Um, those types of disease processes are like familial hypercholesterolemia. So your LDL, your bad cholesterol, will be over 200. If you don't control that kind of risk factor, you start having coronary events sometimes as early as your 30s. So that's one thing that we can help with if you do have that genetic predisposition or mutation that causes elevated cholesterols. Gender also plays a significant role. So typically men develop coronary artery disease about 10 years sooner than females. There is some cardiovascular protective role of estrogens and progesterones in women, and that helps to slow down the growth rate of plaque. We're all forming plaque as we're on the planet. The rate at which you form plaque is dependent on those multitude of things we've been discussing: blood pressure, cholesterol, diabetes, exercise, diet, and obviously your genetics. Um, just to put into context how much you can lower your risk, let's say you have high blood pressure. For every 10 millimeters of mercury that you drop your blood pressure, that's a 20% reduction in a cardiovascular event or stroke. And that's how important blood pressure control is. So that 20% is obviously a relative risk reduction. It's not an absolute risk reduction. So you're talking about a small proportion of patients with hypertension go on to develop those clinical events of stroke or heart attack. But of those patients, you can reduce that proportion by 20%. So it's a relative risk reduction, which is quite large. Cholesterol pills like statins are about a 30% reduction. Exercise, 20 minutes a day, moderate intensity exercise, that lowers your risk by anywhere from 25 to 50%, depending on what trial data you look at. So that's even more potent than a pill for your blood pressure or a pill for your cholesterol. And then diet, most recently studied Mediterranean type diet showed a 25% reduction in heart attack, stroke, and death over a 5-year period on a Mediterranean diet.
Jeez, that is really.
So the takeaway is pills don't fix everything. There's the whole package.
Right. Yeah. So pills can't take away all your risk. Like I mentioned at the beginning of the program, your diet and your exercise, your lifestyle basically plays over a 50% role in what types of diseases you're going to develop over your lifetime. And, health conscious habits are very important. Earlier, you had asked if we have made any progress in decreasing heart disease, and we absolutely have through the use of statins. I think one of the biggest drivers is obviously tobacco. You see less and less people smoking. That's a very large driver of heart disease. That increases your risk upwards of 40% for heart disease or a cardiovascular event. So, with smoking cessation campaigns, statin use, blood pressure control, and then advances in diabetic treatments, we've seen reductions in what we call acute heart attacks. And we've developed more of a chronic disease, like chronic stable coronary disease. You may develop chest discomfort going up a flight of stairs, but that's not going to cause a heart attack. And that's, a big change that we've seen over the last 30 years, basically since the 1990s. We've seen decreases in acute heart attacks and more of a chronic, indolent disease that's a little bit more stable.
I don't know, doctor. I'm still picking up the same amount, if not more, of cigarette butts.
Yeah.
The United States Army taught me how to do that. Okay.
Yeah.
You tear the tobacco pay. Well, let the tobacco go out and whatever. So my God. So, and I cannot, and I see so many people driving in their car and smoking,
Smoking, yeah.
all that kind of stuff, and it's just crazy. So.
Yeah, I see that, and vaping, and I don't think vaping is any safer. Any kind of particulate matter that you inhale into your lungs is going to cause lung disease and heart disease. It doesn't matter if it's necessarily a smoke particle or a nebulized form of nicotine that has oil in it. You're damaging lung tissue and you're damaging heart vessels.
What about over-the-counter supplements or fish oil? Is it interchangeable with a statin?
So it's not interchangeable with a statin. I tell my patients I don't mind if you take fish oil, but there's a couple caveats that we need to discuss. So fish oil can decrease cardiovascular events, but it's a particular type of fish oil. There are two types of oil in fish oil. There's EPA and DPA, and I may have those initials wrong, but the over-the-counter fish oil has 90% of one type of the fish oil and 10% of the other. A clinical trial was performed where they actually flipped that ratio and had 100% of a certain type of the oil, I think EPA, and they dosed it at 2 grams of fish oil in the morning and 2 grams in the evening. And that showed a 25% reduction in cardiovascular events. So that particular drug is basically a prescription form of fish oil. If you look at clinical trials using over-the-counter fish oil, it does improve lipid profile. So your numbers look a little bit better on a blood test, but that doesn't necessarily equate to a decrease in clinical events. So over-the-counter fish oil may help your lipid panel look better, but doesn't necessarily decrease heart attack, stroke, and death. So I don't mind patients taking it. There is one thing that I do tell them. Fish oil technically can thin your blood slightly. So if you're already taking 1 or 2 blood thinners, maybe taking a lower dose of the fish oil is a little bit safer just to limit some of the potential bleeding side effects in combination with all those drugs. But fish oil, I think, is a supplement that doesn't necessarily hurt you for the most part. I can't tell you that over-the-counter fish oil will decrease cardiac events, but I don't mind if you take it.
So Does blood pressure management play a role in preventing CAD?
Absolutely. So you can think of once you develop high blood pressure, that's somewhat of a signal that your endothelial lining, the lining on the inside of your blood vessels, has started to maybe malfunction a little bit. You're not producing as much nitric oxide, or your endothelium is causing vasoconstriction and your vessels are getting tighter. So what we do with medications is we try to lower your blood pressure down to about 120 over 80. And that's not a number we picked out randomly. That's after we look at, tens of thousands or even millions of patients in databases. If your blood pressure is 120 over 80, you have a much lower rate of heart attack, stroke, and death. Like I mentioned before, let's say your blood pressure is 140 on the top, and we put you on a medication and we lower your blood pressure down to 130 with one medication. We just decreased your chance of a heart attack, stroke, or death by about 20% relative risk reduction. And that's quite a large reduction in a hard endpoint. Those are hard endpoints: stroke, heart attack, or obviously not being on the planet. So those are typically things that are important to most people. And when I'm talking to patients about starting medications, nobody's like, yay, I get to take a medication. So I try to um, help them understand a little bit. I feel like if patients understand why we're starting a medication, they're like, well, I guess that makes sense. I don't want to have those bad things happen to me. I guess taking a pill's not so bad in comparison to those other things that can happen.
Gosh, I hear so many people say, I don't want to take any medicine for this. I'll drink some whatever.
Yeah.
It just, what about coffee and return
Yeah.
into this game of heart?
Coffee's good for you. Yeah. About 2 to 3 8-ounce cups of coffee a day has been shown to decrease strokes,
Mm,
decreases cardiac event rates. And in a most recent trial that was just released, caffeine didn't seem to play a role in certain types of heart arrhythmias like atrial fibrillation. So
mm,
having a 2 to 3 cups of coffee, 8-ounce cups, not 22-ounce cups, 2 to 3 8-ounce cups of coffee a day is actually cardioprotective. It can protect against event rates, and it doesn't seem to trigger atrial fibrillation episodes. Now, obviously, when you're looking at trial data, just because there wasn't a statistical significant increase in atrial fibrillation drinking coffee, it doesn't mean one patient may have a sensitivity to caffeine. And when they have caffeine, oh, it triggers my AFib. So everybody's a little bit different, but on the whole, on a population, when you're looking at 10,000 people, caffeine doesn't seem to increase AFib, and it also seems to decrease stroke and in cardiac events.
I check my blood pressure once or twice a day, and I love it when it's 120 over 80 or lower.
Yeah.
But sometimes it isn't that.
Well,
So,
so on average, you want it closer to that 120 over 80.
mm,
We all, have stress in our lives, and it's all dependent on, when you're checking your blood pressure. So if you're stressed out about something at work, your blood pressure is
mm,
probably going to be a little bit higher. It may be 140, 150.
mm,
What we don't want to see is 180, 190 on a regular basis.
yeah.
If the majority of your readings are around 120, that's acceptable. We can't have no spike in blood pressure. Your blood pressure rises as a physiologic response to exercise, emotional state, stress levels, whether or not you had extra salt in your meal the night before.
Mhm.
So sodium plays a role in that too.
Glad to hear that about coffee. I just love coffee. Okay. Okay, I think it's the bottom of the hour. Time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. Okay, I guess we're back. You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning, we are talking with Dr. Mihail Paxos, cardiologist from Aultman.
All right, we talked about a lot of things this morning, but let's talk about diabetes and the overlap with coronary artery disease.
Yeah, so insulin resistance and diabetes is a quite large risk factor to have. I mentioned earlier in the program, if a patient has diabetes, we actually consider that almost as if they've already had one coronary event or one heart attack. Um, why does this pathologic process cause so much plaque accumulation in the arteries? When you have diabetes, you have extra sugar in your bloodstream, and that sugar starts attaching to things, including the wall of your blood vessel. That causes inflammation, and it
Hmm.
causes the wall of your blood vessel to be permeable. So if the wall of the blood vessel is permeable, those tiny cholesterol particles, what we call LDL, low density lipoproteins, that's your bad cholesterol. They're able to kind of wiggle their way into those gaps in the wall of your artery and start to accumulate. So controlling your blood sugar is tantamount in prevention of heart disease or slowing the process down. If you look at clinical data, getting your A1C, which is a common way for us to kind of measure what your average blood sugar was over the past 90 days, if we get your A1C to 7 or lower, we actually reduce your cardiac event rates to somebody who doesn't have diabetes. So if we control your sugar well enough and we get your A1C below 7, you have the same risk as somebody who technically doesn't have diabetes. So there are ways to mitigate the risk associated with having insulin resistance or elevated blood sugar levels, but it is something that both um, your doctor and you as a patient have to work together as a team to get that risk factor under control.
Hmm. Gosh, good.
We've talked a little bit about smoking already. Is there anything else you want to add about smoking's role in cardiovascular health and how important it is to seek out a cessation program?
Oh, absolutely. So that's one of the most important things you can do in terms of preventing heart disease. I mentioned before it's about a 40% increase in cardiac event rates if you smoke. Once you stop smoking, your event rates start to decrease immediately from day one. Um, about 1 to 2 years after stopping smoking, your event rates are about the same as somebody who never smoked. So it's not that, oh, I smoked in my 40s, might as well keep smoking in my 50s and 60s because even if I quit, I'm destined to have heart disease. That's not necessarily true. The moment you stop smoking, you start
Hmm.
decreasing your event rate. So quitting at any time is the best way for you to stay on the planet the longest amount of time you can. And
Hmm.
that's everybody's goal, improving lifespan, but not only lifespan, health span. You don't want your later years to be not enjoyable due to the damage you've done to your lungs or your blood vessels.
Hmm. Gosh. Wow. Yep, Brad.
I think we've covered smoking, so if you want to go on to diet and health.
Okay. What is a heart healthy diet? Do I really have to watch salt and fat intake? They say that most beef and most pork already has enough salt on it, okay? You don't have to salt it down at
Yeah.
all. So,
So if you look at clinical trial data, the higher your salt intake, the higher your event rates will be. Things like hypertension, stroke, um, and heart attacks. So you want to try to limit your salt intake to around 3,000 milligrams a day. The average American diet is a little bit higher than that, as you could imagine, and
mm,
that's without the addition of salt. So even if you don't add salt to your food, you're still consuming a high quantity of salt just naturally present in the food that we eat.
yeah.
Um, Saturated fats, you don't want to overwhelm your body's ability to handle saturated fats. So, in terms of diet, if you're going to
Mm,
have animal products, you want to make sure that they're a little bit on the leaner side, maybe not having a ribeye steak, maybe a leaner cut of beef.
mm,
And you also want to prepare these things in a way that are heart healthy as well. So, when you're eating chicken, maybe frying that chicken in oil is not the healthiest way to consume that chicken. When you dip that in oil, you're increasing the fat content and you're overwhelming your body's natural ability to control that saturated fat, turning into cholesterol clogging artery particles, right? So diet is very important. One of the more robust trials that we have was a trial called PREDIMED, and that was in the New England Journal of Medicine in 2018, and it looked at Mediterranean diet versus low-fat diet. There was about 8,000 participants over 5 years. Half of them were randomized to just eat a low saturated fat diet. That's all the counseling they were given. They told those 4,000 patients, just kind of try not to eat too much saturated fat. The other half, they put on a Mediterranean diet. And in that diet, they included extra virgin olive oil. And they actually provided the participants with a liter of extra virgin olive oil, and they had to consume that liter over the month. So that's a couple tablespoons of extra virgin olive oil mixed into your food per day. In that trial, the participants that adhered to the extra virgin olive oil and Mediterranean diet had a 25% reduction in all-cause mortality. So that's death from any reason, cancer, stroke, heart attack, any cause. They had a 25 to 30% reduction in cardiac event rates, so stroke and heart attack. So it showed that, can you consume animal product? You can consume animal product, but in a controlled fashion, right? You don't want to overwhelm your body's ability to handle the amount of saturated fat you're intaking. And it goes back to the old adage, moderation in everything you do. You can't have a T-bone steak every day and expect not to develop a side effect from that. So, everything in moderation. And I think that trial is some of the most robust clinical data that we have showing the effect of diet, the types of things you include in your diet, reducing all-cause mortality, heart attack, and stroke.
Gosh. I'd like to have a steak every day, but you can't afford that either.
Well, yeah, it's kind of a built-in safety mechanism, I guess, is the price,
right.
but
For sure.
yeah.
Oh, gosh. So, how important is exercise in the prevention of CAD? How much should exercise?
Yeah, so that's a very common question that I get. So any amount of exercise is good for you. You should try to exercise 120 minutes to 150 minutes a week. So what I tell and it doesn't have to be running wind sprints up and down a basketball court or doing an hour-long Peloton bike class or running 6 miles. You can do a 20-minute walk after dinner. That 20-minute walk, you should try to have an average pace of 3 miles per hour. That's a fast walk. Jogging is 4 miles an hour. Running is 5-6 miles an hour, right? So 3 miles an hour is a fast-paced walk. Like, oh, I'm late for my airplane. I got to get to the gate. And you don't want to run and look silly in the airport, but you're trying to walk with purpose. So if you do 20-minute walk after dinner and you walk 1 mile in that 20 minutes, so a 3 mile an hour pace, that's a 25 to 30% reduction in heart attack, stroke, and death if you do that 7 days a week. And it's just walking. To hit the optimum reduction in heart attack, stroke, and death, walking 90 minutes per week, you hit a majority of that reduction. But if you're walking 20 minutes 7 days a week, you're obviously going to walk more than 90 minutes. So the more, the better. But just 90 minutes of walking straight. So, in chunks of 20 minutes, you can't walk 5 minutes Monday morning, 6 minutes Tuesday afternoon. Should try to do a 20-minute walk at a time. So 90 minutes total in a week, you hit that kind of optimum reduction in heart attack, stroke, and death. 45 minutes of jogging in a week is that kind of sweet spot where you hit optimal reduction. 30 minutes of running, 50 minutes of bicycling, 45 minutes of swimming, 45 minutes of tennis, or pickleball is popular now, or 90 minutes of weightlifting. So, and that's in a week, not 90 minutes a day. So you can see just a 20-minute walk per day, you're going to hit your optimum reduction in heart attack, stroke, and death without having to, break a sweat and, have sore muscles. Just a 20-minute walk after dinner, just kind of make it part of your daily routine. And you're going to have a significant reduction in event rates.
Okay, I believe it's our final break, correct? And it's time for our final break. You're listening to Health Matters with the Medicine Center Pharmacy. Okay, I guess we're back. Welcome back to Health Matters with Medicine Center Pharmacy. I am your pharmacist, Paul White. Thank you for joining us. Let's get back to the last segment of the show with Dr. Paxos.
All right, well, let's talk about some other things that contribute to good health, especially heart health, like stress or sleep apnea or even alcohol.
Yeah. So in terms of stress, so the best thing you can do for stress relief to burn off stress hormones is exercise. So when you have a stress, your body responds to that stress by releasing cortisol. So that's a stress hormone released by your adrenal gland above your kidney. You release epinephrine, which is adrenaline. These hormones raise blood pressure, increase heart rate, cause a change in your metabolic pathways. So increased cortisol levels cause you to develop central fat deposition. So putting fat around your tummy, it causes your cells to be less sensitive to insulin. So the best way to burn off these stress hormones is exercise. When you exercise, you burn off those hormones, you decrease their levels, you bring your body's physiologic response to that stressor back into a normal range, and you limit the effect that that stress has on your body as a whole in terms of cardiovascular health and blood pressure. So stress management, one of the best things you can do is that exercise to burn off the stress hormones. All of us, none of us can really control what types of stress we're exposed to throughout our daily lives, be it through work or family issues and things like that. Those things are outside of our control, but there is something inside your control that you can do to help manage that. And that's as simple as going for that 20-minute walk and just clearing your mind a little bit, burning off those stress hormones and letting your physiologic response return back to a normal level. Obstructive sleep apnea. So sleep apnea is a large risk factor for bad things to happen. Untreated sleep apnea increases your chance of death from any cause by about 4 times. You have a 4-time higher chance of not being around if you don't treat your sleep apnea. I know sleep masks are somewhat uncomfortable for people. I always encourage my patients, if it's uncomfortable, there's other masks, and it's kind of trial and error. We can try this type of mask or this size, maybe fits a little better and is more comfortable, but not treating your sleep apnea increases your chance of not being around by 4 times. So it's quite a large risk factor. It's a large stressor on your heart and your cardiovascular system. When you're not breathing properly during sleep, your oxygen levels drop. So you may desaturate from a normal level of 95, 98% down to 80%. Your body interprets that as you dying. And your body does not want that to happen. And it releases cortisol, adrenaline, your blood pressure and heart rate spike. You never reach deep restorative sleep. So it has implications for brain health in terms of development of Alzheimer's disease or memory or cognitive issues later in life. If you never reach deep sleep, you never wash out those metabolic toxins that you use during the day. In the way that I describe those metabolic toxins in your brain uses 20% of your resting metabolic rate. So 1/5 of the calories you burn are just consumed by 1 or 2 pounds of neural tissue in your head. The rest of your body is the majority of your weight, and it only uses 80%, the remaining 80%. So your brain is quite metabolically active, and not to reach deep sleep you don't wash out those toxins, and that has a detrimental effect over months, years, and decades. Um,
Hmm.
so you want to take that risk factor quite seriously. I know it's uncomfortable to wear the mask, but um, it'll pay off dividends in the end.
Doctor, can you touch on symptoms that people should be watching out for and how important it is not to ignore those symptoms?
Yeah. So symptoms could be something as simple as, when I went grocery shopping yesterday, I was getting more short of breath than I normally do. A good guidepost for patients to keep an eye on is having a nice set exercise regimen as a guidepost. So if I know my 20-minute walk after dinner, I can walk up this hill in my neighborhood with no problem. And then all of a sudden in September, I'm halfway up that hill. I feel a little uneasy. I can't catch my breath. There's a little bit of a tightness sensation in the muscles around my neck or my chest. That's a sign that something has changed, and that's a trigger for you to contact your physician and get seen immediately to have that issue investigated. So shortness of breath, chest tightness when you're exerting yourself, decreased exercise tolerance, and that happens to people who exercise too. So
Jeez.
not very infrequently, a runner will come in and say,
Mm.
my mile times were 9 minutes. All of a sudden, my mile times have increased to like 12, 13 minutes. I'm more short of breath. I don't feel like I have the energy I had. So exercise doesn't heart attack proof you, right? Diet doesn't heart attack proof you. Statins don't heart attack proof you. All we're doing is we're lowering the odds of bad things happening. So just because you eat right, I take a cholesterol pill, I run 3, 5 miles a day, it doesn't mean you're heart attack proof. If you have symptoms, you should take those serious and contact your physician and have a stress test or an ultrasound done for further investigation.
Wow. All right, doctor, we're running real
Wow.
close on time. So, how about what takeaways do you want the listeners to hear today about heart health and set yourself up for success?
So, diet and exercise are tantamount in prevention of heart disease. When we start developing pathologic processes, sometimes diet and exercise are not going to be able to reduce your risk. And that's when we start reaching for things like cholesterol pills, blood pressure pills, diabetic medications. Those things are not bad, right? And it doesn't mean that diet and exercise are not good. You should still do those things. That's something that you can do for yourself to improve your odds of not having these bad things happen to you. When those things aren't enough, when you develop a pathologic process, we have to reach for medicine sometime. And it's not a negative. We are fortunate to live in a time where we have medications and trial data and evidence and things to show if we do XYZ, we can help you reduce bad things from happening over the next 10 years.
Wow. Well, we're very close to the end, aren't we?
We are, but we have time. Can you just talk about where you practice at again, Dr. Paxos, and how
So,
listeners can get in touch with your team?
sure. I am at Aultman Hospital. I work in the Aultman Heart and Deuble Vascular Institute here at Aultman. Our cardiology practice is called Cardiovascular Consultants. If you Google cardiovascular consultants, our phone number is right there. We will have you seen very rapidly, and we take pride in seeing patients as quickly as we can to alleviate the stress that patients have. You're dealing with your heart. You don't necessarily want to hear, oh, well, we don't have an opening for 6 months. That's not going to make you feel good, and that's going to be a long 6 months to wait with that type of anxiety about heart health. So we take pride in seeing patients as quickly as we can to alleviate your stress and to make sure that we're not missing something very serious with your heart health.
Excellent.
Fantastic program, Doctor. I learned a lot, and I'm sure our audience did. And I appreciate you coming on the air with us. We've been on the air for 16 years.
Wow.
So we've had an awful lot of Aultman guests over the years, and Boy, Aultman staff is just amazing. Gosh. So thank you so much, Dr. Paxos.
Thank
If
you.
you suspect you have a medical issue, please contact your healthcare provider. Thanks to Aultman Health System and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again right here next Friday on News Talk 1480 WHBC. Thank you very much, Doctor.
Thank you
Thank
for
you very
having me.
much.
We really
Thank you.
enjoyed it. Really enjoyed it. Thank you.
Thank you.
Have a good day.
You too.
Yes.